Hi there, it's Dr. Bruce Lachaux with Elevation Dental Group, here to answer your questions about what are recessed gums and how can that affect your smile. Here we see a normal smile in this model, where the gums are down over the necks of the teeth. In some situations, when people brush too hard or grind their teeth, they get recession happening on their gums. Sometimes people will find if you go up on your root surface with your fingernail up above the tooth, there'll be like a little notch developing. And as those notches develop, people will get more recession where the gums will get arched up. One of the most common things this is called is like a long tooth. And people don't really like to have long teeth like horse teeth showing. Well, one of the things about why you should take gum recession seriously is because it can lead to tooth loss if left unchecked. Because once the attached tissue from our gums is lost, we can get rapid recession and end up with a gum infection where we shouldn't have it. In recent years, there's a new technique out called pinhole surgical technique. It was developed by a doctor in California, Dr. Chow, and a few years ago we were able to get trained and certified in doing this procedure. So a lot of people say, well, what's this new technique like, the Dr. Chow method, the pinhole surgical technique, compared to the old technique? On the old technique, dentists would harvest tissue from the roof of the mouth and transplant it to wherever the recessed areas are. With the pinhole surgical technique, it's a lot different. It just involves making a little pinhole in the gums up here and using special surgical instruments to loosen the gums and reposition them over the recessed areas. Once they're all released, they fall into a natural position over the teeth. Then we support that with collagen fibers that we place inside the gums. A lot of our patients have remarked about when they went through the old technique where they would harvest tissue from the roof of the mouth and do the transplant, that they ended up with pain for 3 to 4 weeks. And when they've had our surgery with a pinhole surgical technique, they've had minimal pain to the point where they either take a Tylenol or just an Advil and they're fine the next day. With the pinhole surgical technique that we do, there are no grafts, no sutures, no incisions, and it requires very little healing time. What we find is, all we're doing is repositioning your own tissue where it should be.